The clock is ticking for lawmakers to extend the governor's executive orders to address health staffing issues in the state, as hospitals are still struggling to keep up with the latest coronavirus surge. And this is where we start tonight. Thank you for joining us. I'm Brooke Lunnington. KSNT News Capitol Bureau reporter Rebecca Chung is joining us live now in Central Topeka to explain how hospitals are dealing with this increased demand. Rebecca?
Thank you, Brooke. Well, here in Northeast Kansas, hospitalizations are still very high. At Stormont Vail, they say more than 90% of the patients they're seeing are either unvaccinated or haven't kept up with their shots. They desperately need staff to take care of the more severe cases, but without the governor's executive orders in place, they could be in a tough spot.
Health staffing shortages are causing chaos for hospitals trying to deal with an influx of patients. It's even forcing some, like Stormont Vail and Topeka, to shift workers around to handle it all.
We've had to shift staff and draw people from other areas like the operating room, where we've scaled back on non-essential surgeries, as well as some of the primary care clinics.
The state has just days before the governor's executive orders expire, which allows other trained healthcare workers like medical students to step in where they can, so doctors and nurses can focus on more critical cases. It's now on lawmakers to extend the orders and pass them into law. And with a dwindling number of staff, some out sick, and some buckling under high levels of stress, some doctors and nurses say it's one thing they need to move forward.
We've also been able to have student nurses do more things for us, as well as other people with clinical training. And what those folks can do is really help the nurses with anything that they need to do. Even taking care of one more patient is really important. And so to the extent that we can free up more nurses to do work, it's critical.
Now, if lawmakers don't work quickly to pass these executive orders into law this week, then not just hospitals like this one, but nursing homes and other care centers will be in a tough spot when it comes to finding staff to take care of the amount of patients they're seeing. For now, reporting live in Central Topeka, I'm Rebecca Chung.
All right, thank you, Rebecca.